Good morning. Honorable Minister, Her Excellency Dr. Mekdes Daba, Minister of Health of the Federal Democratic Republic of Ethiopia. We also want to acknowledge in anticipation its Honorable State Minister, His Excellency Dr. Dereje Dugma, State Minister of Health. Hopefully he will join us soon. The ARIDE network partners and scientists, government representatives from various ministries across the Sub-Saharan Africa, delegates from multilateral agencies, UNICEF, WHO, Africa CDC, donors and funding agencies, heads and representatives of nations, national and international organizations, vibrant young people who are here today, elite scientists, researchers, educators, students, parents, and the press, all the protocol observed. Nkwaan dana metachu. Welcome. Honorable guests, ladies and gentlemen, esteemed guests, it is with great honor and gratitude that I welcome you to this conference on behalf of the Ministry of Health, the Addis Continental Institute of Public Health, the African Academy for Public Health, the University of Ibadan, and all the ARISE network partners. This conference is dedicated to discussing one of the most critical issues of our time, the adolescent health. We convene today as a collective force, united in our resolve to address the critical challenges facing adolescent health in the region. The conference is a robust platform for the adolescent network, strengthening knowledge exchange, transfer and translation of policy and utilization. It also paves the path towards a healthier future for our youth. Today, we also celebrate the 10th anniversary of the ARIDE network, the African Research, Implementation, Science and Education Network. The network, from its inception, nurtures excellence in public health, research, education and collaboration. Established in 2014, the ARIDE network has united 22 premium institutions, education and research institutions across 10 sub-Saharan African countries, with esteemed partners from the United States, notably the Harvard University, and Europe, notably the Heidelberg University and also the Technical University of Munich. In a collaborative mission to advance adolescent health across the continent. The network is unique in the sense that it looks for the commonality, what is common across sub-Saharan Africa, but without losing focus on specific contexts. It also emphasizes strong South-to-South collaboration and country ownership. We are also honored to witness today the launch of the African think tank for policy on adolescent health, on adolescent and youth health, a pioneering initiative that seeks to facilitate dialogue, foster collaboration, and drive meaningful change in the adolescent health policy space. This think tank represents a critical step towards to step forward in our collaborative efforts to bridge the gap between research and practice, ensuring the evidence-based solutions are translated into tangible outcomes that positively impact the lives of young people across the continent. As you know, the challenges facing our youth are multifaceted and complex, encompassing a wide range of issues from mental health and substance abuse to reproductive health and infectious disease. It's only through our collective action and unwavering determination that we can effectively address these challenges and create a brighter future for the next generation. By actively engaging with young people as equal partners in this journey, we can ensure that our efforts are truly relevant, impactful, and sustainable. The ARISE network is also a platform for capacity building and mentoring young practitioners, academicians, and researchers on the continent. Alongside with this conference, training programs and mentorship opportunities were provided. The conference also facilitated dialogue on critical adolescent health issues with relevant stakeholders. These forums provide opportunities to exchange ideas, brainstorm on strategies to prevent and mitigate adolescent health challenges. The network has been engaged on how to improve health workforce development on the continent. A landmark publication on the survey we conducted was published by the Lancet Public Health in May this year. An expert group, in collaboration with relevant stakeholders, is currently deliberating on the way forward. We do like to engage ministers of health, education, and relevant stakeholders to discuss ways to expedite the network's engagement in this particular space. The network has coordinated research undertakings on adolescent health issues and other critical issues on the continent, such as the COVID-19. The network produced an impressive number of scientific publications, but what is more impressive is we have developed policy briefs to facilitate the utilization of the findings by practitioners and policymakers. Currently, the network researches on mental health, nutrition, and physical activity and sexual health in Sub-Saharan Africa. So the research is being coordinated by sites, at least in 7 countries. I urge every one of you to embrace this opportunity to engage in dialogue with humility and respect, and to galvanize our collective energies towards the common goal of advancing adolescent health. Let us harness the power of collaboration, innovation, and solidarity to drive positive change and create a world where young persons have the opportunity to thrive and succeed. I would like to take this opportunity to acknowledge the bold steps being taken by our government to advance adolescent health agenda. In recent years, Ethiopia has developed commendable strategies and policies that are relevant to address the pressing adolescent health challenges and also promote the well-being of adolescents in Ethiopia, both in terms of health, social, and economic, addressing economic challenges. This conference would not have been possible without the unwavering support and dedication of our partners. Our utmost gratitude goes to the Minister of Health of Ethiopia, especially to the Minister Dr. Mekdes Daba and the Test Minister Dr. Dereje Dugma, who wholeheartedly supported the organization of this conference, and they were daily following where we are and provided the support we needed in many ways. I also extend heartfelt thanks to all our funders, including GIZ, the European Union, UNICEF, and many others who graciously and have made contributions. And I would like to say that your dedication and commitment to advancing the well-being of our youth have brought us all together here in Addis with a shared purpose and mission in mind. I also wish to appreciate the efforts of the organizing committees in several locations. Coordinating this conference was not easy. So I would like to acknowledge the dedication of the teams in Addis Ababa, Dar es Salaam, Heidelberg, and Boston. Thank you so much for your dedication and hard work that brought us all together here. With this, I would like to welcome you all to the conference in Ethiopia. We look forward to hosting you in the coming 2 days and making your stay as pleasant as possible. Addis Ababa, the capital city of Africa, has so many things to offer to its guests, and I encourage you to explore sites as much as you can. With gracious invitation from the Ministry of Health, you are all cordially invited to visit the exhibition tomorrow and also some important sites in the city. በድጋሚ እንኳን ደህና መጣችሁ. Welcome. Thank you.